Imagine discovering that a product meant to nourish your baby could potentially harm them. That's the alarming reality facing parents across 10 states right now. ByHeart, a maker of organic baby formula, has issued a recall after federal officials linked their product to a multi-state outbreak of infant botulism. But here's where it gets even more concerning. The U.S. Food and Drug Administration, FDA, reports that 13 infants have been hospitalized since August after consuming ByHeart whole nutrition infant formula, though thankfully no deaths have occurred. The recall specifically targets 2 lots of the powdered formula, with a December 1, 2025, use-by date. The affected lot numbers are 206 VABP/251261P2 and 206 VABP/251131P2. If you have this product, the FDA urges you to record the identifying information at the bottom of the packaging and dispose of it immediately. Retailers are also working to pull all potentially affected products from shelves. Infant botulism is a rare but serious condition caused by a toxin produced by bacteria. It can lead to symptoms like constipation, poor feeding, loss of head control, and difficulty swallowing, and, in severe cases, it can result in paralysis or even death. The Centers for Disease Control and Prevention, CDC, emphasize the importance of early detection and treatment. And this is the part most people miss. Botulism symptoms can take weeks to appear, so the FDA advises parents and caregivers who've recently fed ByHeart formula to their children to monitor them closely. Cases linked to ByHeart have been reported in Arizona, California, Illinois, Minnesota, New Jersey, Oregon, Pennsylvania, Rhode Island, Texas, and Washington. ByHeart, based in New York City, stated that it was notified on Friday about the FDA's investigation into 83 reported cases of infant botulism nationwide since August, with 13 babies having consumed their formula. The company claims that both government and internal tests have not detected botulism in their product. They've taken a proactive step by recalling the formula to eliminate any potential risk, even though the FDA has not established a direct link between the formula and the cases. But here's the controversial part. ByHeart asserts there's no historical precedent of infant formula causing botulism. Is this an isolated incident, or does it signal a broader issue in formula production? The FDA is testing leftover formula from several states, with results expected in the coming weeks, to determine the point of contamination and whether other adding to the concern, California's Department of Public Health has reported a rise in infant botulism cases among babies who consumed ByHeart formula since August. ByHeart markets its product as a healthier alternative, made with organic grass-fed whole milk, which they claim is closer in composition to breast milk. Their facilities in Iowa, Pennsylvania, and Oregon supply formula to nearly 12,000 retailers, though the FDA notes that ByHeart accounts for less than 1% of U.S. baby formula sales. The good news? Infant botulism is treatable with Baby Big, an FDA-approved medication containing antibodies to combat botulinum neurotoxins. This situation raises important questions. How safe are the formulas we trust to feed our infants? And we'd love to hear your thoughts. Do you think this is an isolated case, or does it point to a larger issue in the baby formula industry? Share your opinions in the comments below.